The Royal College of Nursing, the nurses' union, used to be avowedly anti-strike action. Not anymore. Its members now feel they have no choice.
I think the pay is ridiculous, basically, and over time, with inflation, you can see that your pay is actually decreasing, and with the cost of living crisis as well, it's just another added pressure. Nurses are doing extra shifts, bank shifts we call it, to make ends meet, but that ends up meaning that you're more exhausted because you're already doing your normal shifts.
It wasn't long ago that nurses were applauded on doorsteps up and down the country for their work saving lives during the pandemic. Now they're quitting in record numbers. Because clapping, as they chant, doesn't pay the rent, and nor does the 4% pay rise currently on the table. The nurses are demanding substantially more, as much as 19%, to make up, they say, for years of low pay that's failed to keep up with inflation. The government says the money just isn't there to give the nurses what they want, as well as giving the National Health Service what it needs to survive. You can't have one without the other, the nurses say, and unless the government engages in pay talks in the coming days, they warn, there'll be more of this in the new year.
So I think because it's come to a point where it's an existential threat, our shortages and the collapse of morale in the NHS, it's an existential threat to the future of the NHS. We are now committed to fighting not just for decent pay in our pocket, but a sustainable NHS where people can afford to live and work in a capital city like London.
Opinion polls suggest the public are on the nurses' side, hooting their support despite the inevitable disruption being caused to non-urgent patient care. And that's uncomfortable for the government, determined not to give in to striking workers, while increasingly being blamed for bringing the National Health Service to the verge of collapse. Jonah, Al Jazeera, London.